Hi, everybody. Thank you for coming. I'm going to make this very informal. I really want to be able to answer your questions and explain the Blu Room the best I can. And I'm going to keep it in mostly layman's terms unless I get a pointed question that needs to kind of move up with some of the answering using some big medical terminology. But otherwise, I'm going to keep it just very simple. The Blu Room is what we call, or it's a pinnacle of what we call frequency medicine. Frequency medicine has been around for a long, long time. And it started with light medicine. Light medicine has been used for over 100 years to treat anything from psoriasis to polio to some forms of blindness, even some forms of what we call alopecia. Who knows what that is? Docs? What is alopecia? Hair loss, yeah. There's been lots of different reasons people have used light. Many different things. And what we've found about light is that science will tell you, physics will tell you, is that you are light. You emit light. You emit a frequency. You emit from your cells what we call you, your essence. And we can pick this up in what we call an aura camera, or even an MRI, your magnetic resonance. That's how we're able to take pictures of you through MRI, because you give off a certain frequency. Otherwise, we wouldn't be able to. The Blu Room came about for many different reasons, but mainly it came about because I was frustrated as a doctor. Seeing patients of all types for years, I would have a difficulty treating some of the pathologies that would come in, and especially if patients were at what I call death's door. I didn't have a lot of time to do much. And so I started to see patients pass, and as a physician, you take it on, you do. Those of us in the medical field, you know, you go home, you hit the pillow, you think about your family, but I guarantee you think about patients, especially if you care about those patients. They're always here. How can I help them more? What can I do? And so I started to investigate into some things that would have no side effects and give the greatest results that I possibly could give a patient. Now, I'm also a chiropractor. I was trained as an MD first, but I went to chiropractic because it is low invasive versus the results that you get, meaning the adjustment can give a life-saving, really a life-saving need to a patient, whether it's blood supply from the carotids up to the brain, whether it's helping digestion to assimilate food when your spine is out of alignment. You guys know this. If you're seeing the docs here, you know this. You know how important chiropractic can be. So I started to go into investigating the history of frequency, because I knew frequency was where it was at. And along with the other founder of the Blu Room, we started to put our minds together. And we started to come up with some things, some ideas, some trials. So this is about 5 years in the making, really, on two different spectrums of realities. And when we finally came up with something, we had to figure out where to test it. We had to figure out where we're going to test this. And so I was the first guinea pig. And I had some issues being very active in my life, being an athlete. I was a veteran. I was injured in the Iraq War. So I had some things with my body that weren't quite where I wanted them to be, but they were manageable. So when I built the first Blu Room, I was the patient. And I started to document things. And what I noticed first, the first thing was the clarity of my mind. I started to know that I didn't have all of this fog that was in my head. When I woke up in the morning, I didn't feel fuzzy. I didn't feel that I was trying to get thoughts to go together. You know, when you just need a cup of coffee, we think, oh, I just need a cup of coffee. It's not always just a cup of coffee. There are probably some physiological ramifications that you're having. Stress, life, being overworked, lots of different things. Hormones, lots of different things. So I first started to notice that that was happening to me, that I had clarity. Clarity. Then the next thing I noticed that my pain levels were going from about a 7 to 6, which I thought was manageable, down to a 2 or 3. And I was able to be on my feet all day long with my patients without going home at night and going, my God, I'm destroyed. Who's been on their feet all day in here? Yeah, you know what I'm talking about. I mean, you feel just wrecked sometimes after a day. I noticed that I had energy. And that energy, for me, played into more time with my children. I wasn't so tired that I couldn't spend time with them. And then something remarkable happened to me. During the Iraq War, I had a very serious injury where I almost lost my left leg. And because of that injury, I wasn't able to do certain exercises very well. Squatting, running, those type of things were very difficult for me to do with enjoyment. I had a lot of pain. I noticed that I didn't have that pain. I didn't have the same tissue tearing feeling in my body that I had. And it had been almost 15 years that I'd done a barbell squat. And so I decided to go to the gym one night, and I go, I'm going to try this. We'll see what happens. I did it. No pain, no joint problems. So that prompted me to start doing x-rays on myself. And what I had noticed was that the head of my femur, which had been eroded away due to injury, started to regrow. Now this is remarkable, because most of the time when you have a serious bone loss, you have it for the rest of your life, and you get what's called a scar or a scab on top of that bone. Mine was gone. So then I said, I think this is ready for some trials. I think this is ready to have some patients. And in my practice at the time, I had what are called, or what I termed, the last chances, or I was a last resort doctor. I had a lot of people coming to me with stage 4 cancers, tumors, things that were, they didn't know where else to go. And I asked them, would you volunteer for a study? Would you volunteer for something different? Of course, when you tell it to a patient, they kind of go, whoa, wait a minute, doc. What are you going to do to me? And I started to explain the Blu Room to them a little bit. And I'm going to give you one example. I had, and she doesn't mind that I use her. Her name is Shirley. She was 37 years old and was diagnosed with stomach cancer. Stomach cancer that turned into colon cancer. Colon cancer that turned into rectal cancer. And this is over a period of 2 years that she was my patient chiropractically. So when I came to her and asked her, she was ecstatic to try anything at this point. And the first month, I required her to come twice a day. We noticed her energy level started to go up exponentially with the use of the Blu Room, which stomach cancer, if anyone has known a family member, somebody, or if you've had stomach cancer, you know that your energy is gone. You can't digest food. You can't eliminate properly. There's many, many different things that are happening to the body. And I noticed at the end of that month, she was beaming, coming into my office saying, I feel great. I feel fantastic. And I said, well, we need to get some scans. We need to do some other things. The cancer had decreased by 30%. No chemo, no radiation, no surgery. And she started to be in life again. She started to have life again. So I said, well, I want more patients. So I started to take on patients, anything from diabetes to musculoskeletal problems. I mean, the list goes on and on and on. And what I found is a majority of these patients were having really positive results. So we started to do more research. And at the end of my first year with the Blu Room, the success was such a great success that we were published, not here in the US yet, but we were published in Japan, we were published in Latin America, and I was invited to speak at the Facultad de Médico in Quito, which is the university, the medical university in Quito. And we discussed what the Blu Room was. Now, a lot of us don't get to hear news or medical news in other countries because you live in the US, so you hear what's happening in the US. But a lot of countries, frequency medicine is very important. Most of the world, most of everybody, we're a little tired of how the medical system has been run. We just are. I'm a medical doctor, remember this. So I'm not trying to say that the medical institution is bad. I'm just saying it's difficult with all the red tape that we have to push things through anywhere in the world. And this is something that we've found that people are ready for. So in combination with different people around the world, people started to buy the Blu Room. And the first few that started to buy a Blu Room, it was mostly because they had a practice of some sort, they heard the benefits, they were willing to try this. But what we required is that everyone starts to do a little bit of their own research with this. And everyone that bought one, the first 5, we required that they do a minimum of 10 case studies. And all 10 case studies of all 5 clinics proved almost 100% healing. I mean, that's almost unheard of. So then we started to go a little further. We started to sell more Blu Rooms, and we started to see even more. So now we have patients of almost every type of pathology you can imagine who have had healing results. Anything from brain tumors to certain types of cancer, even some blindness, all the way to juvenile, all the way to geriatric, from young to old. It didn't matter. So you're very blessed to have a Blu Room here. Very blessed to have a Blu Room here. And in conjunction with other medical services, you're going to find that it can help with the majority of your problems that you have. Now, who's wondering how it works? You're made up of cells. You are a beautiful conglomeration of cells. Hair cells, skin cells, eye cells, brain cells, but they're all cells. They all have a basic function to be a cell. They have different jobs, but they're cells. And every cell gives off a communication or a frequency. They talk to each other. That's how they know what their job is. So in the body, when you get a cut, who's had a cut? Everybody probably. It's the hazard of being alive. How does your body know that you even have a cut? How does the body know? There is a communication system. And in chiropractic, we call it the innate. We call it the inborn system in your body that can communicate with itself to know when it needs help, to know when the immune system needs to be on, to know when your digestive system needs to be on, and it works with your nervous system. Okay? So the Blu Room, basically what it does, in a nutshell, this is very simple, is that it talks to your cells. Doesn't matter what cell it is, all cells have basically the same communication, but it talks to your cells. And the way it talks to it is go from a sick frequency or speaking to each other that you're sick to a healthy frequency. And then those cells in turn communicate to the rest of the cells to be healthy. Does that make sense? It's a very simple way of discussing this, but that's what it does. Now, who can think of something else that does that? Yeah. Yeah. It's a frequency. The Blu Room just has been augmented a lot. So it's very powerful to do this. But food does that to you. When you eat something healthy and it goes through the digestive system, the body then breaks it down into little tiny macro and micronutrients. And the body then takes those nutrients to do what? Rebuild cells. And the way it rebuilds cells, you hope, is healthy, especially if you're getting healthy food. Now, what happens if you get unhealthy food? What are you making? Unhealthy cells. So what do you do if you have a lifetime and you don't know? Because a lot of us don't know. You have chemicals on your body. Your environment may be a little toxic. You have tons of stress. So then your cells are starting to communicate a sick frequency because they don't have a choice. This is what they're being made of. Do you understand? So then you need an intervention before you do get sick. This is where the Blu Room comes in. Along with chiropractic, along with nutrition, along with other modalities, the Blu Room can make such a difference in how your body is communicating with with itself. Who drinks water here? Do you know water has memory? Yes. Who knows water has memory? Who's heard that story? There's a wonderful Japanese scientist who did a beautiful study. You've heard of it? You guys have heard of it? Yeah, I actually work with him. Brilliant man. He did a study years ago about how water can hold a memory, just from a word. So he would have jars of food or water, and he would put a word on it. Love, hate, stress, sick, healthy. And what he would find is that frequency of that word, because of your intent, would change the molecular structure of that to either be putrid for the food, or it would be healthy, or the water would have a bitter taste, or it would have a normal taste. Now, why is that? Let's speculate. You guys are all smart people here. Why is that? How does that happen? Energy, right? Well, physics will tell us this. This is science. I'm not going to get into religion or anything else like that. But science will tell you your frequency of your cells that makes up who you are, you can share that. You share that. So when you were little and you got an owie, who did you run to? Why? Why would you run to mom? She's nicer. Okay.
More sympathetic.
More sympathetic? Yeah. Maybe. Maybe that's very true.
Maybe that's why it's saying nicer.
Yeah. But it was the frequency that mom would give you. And we know in science the kiss doesn't do anything, but it's that intent behind it. Do you understand? It is that love that comes in behind it. And it's real. Who's experienced love here? I'm going to ask the hard questions here. Is it real? Is there a meter that can measure love? Not yet. Not yet, but it's real, isn't it? This really is the basis for what frequency medicine is. But now we can measure it. Now we understand it. This is where the future of medicine will go. Now, those of us who are in the medical field will tell you, if they're honest, procedures really haven't changed much in the last 50 to 60 years. Really haven't. Suturing's the same, drug therapies are about the same. All of those things are about the same. Now, is that a bad thing? No. In some cases, thank God they're there. I mean, if I had a broken leg or I had to have surgery again, I would want to go to a good hospital and have that done. But at the same time, what if we had something that did all of that healing without having to have surgery or drugs? What would you choose? That's a question, that's a question that you all need to start asking yourselves. Why do we pick chiropractic versus back surgery? One, chiropractic works. Two, it's less evasive. The recovery is so much healthier, it's so much easier on the body. This is where frequency medicine comes in. And it can make a huge difference. Huge difference. All right, I'm going to open up for questions because I hope there's a lot. All right, yes?
Why blue?
That's a good question. Blue is of a spectrum in the light spectrum. Who's taking chemistry here? Do you remember the light spectrum of chemistry? Chemistry is based on light. Chemistry is based on light. And you are a chemical being. So in the chemistry, or the chemical spectrum, the UVB is a healing frequency. It's in a frequency that is where your body takes that and is able to process healing. So the blue happens just to be blue. I didn't pick it, but it just is. So that's why. More quick, please.
If you can answer this in a simple way.
Sure.
How did you determine the need for, and then how did you come up with the design for the angled mirrors? And what do they do?
Right. Geometry is something that is really, it's a forgotten science, really. It's something that we have kind of taken into a new paradigm now, but who's heard of feng shui? Everybody has. What is that based on? Why? Why? For energy flow, for some say luck, some say this is going to bring peace, but it's the position of certain things relative to what? You, the living being. In physics, geometry basically will tell you this is how light will travel based on an object that the light will refract off of. So we pick the octagonal shape for reasons, but the main reason is how the light will be refracted off of the reflective surface. And when light is refracted a certain amount of times, it increases. So let's say you have one beam of light and it hits 2 mirrors. How many beams of light do you have now? It multiplies exponentially. So now you have 4 beams of light. Do you understand? And then that can go on infinitely as the reflections go and go and go. Now when you have that, you create a whole vacuum of light. So instead of having just one beam hit you like a laser would hit you, this is now all-encompassing. And your body is designed to absorb light. So when you're out in the sun, everybody knows you get a good shot of vitamin D, right? But there's more. There's more to it. There's a communication system that happens. Do plants need light? There's something called photosynthesis, correct? We tend to think of our absorption of light only as getting vitamin D, but we know chemically there's much, much, much more that happens. When you have a good shot of sunlight, your immune system goes up, your thyroid balances, your brain chemistry balances, but also something else happens to your cells. They start to increase function. Who's ever noticed that they lose weight during the summertime? Are you more active? Why? You feel good. There's certain things that happen. Children always have growth spurts in the summer. There's less illness in the summer. Now you want to start thinking about these things, not just as coincidence, but there is a real scientific reason behind this. And my belief is there's an increase in vitamin D. That's one. But also about what chemically happens when you're happy. It's very, very good. All right. Does that answer your question?
Mm-hmm.
Okay.
Thank you.
Yeah,
Do you have any osteoporosis case studies?
I do. And ankylosing spondylitis as well, if you've heard of that.
Yes, I have.
We've had a total resolution of lots of osteopenia and osteoporosis, but the one that I'm most happy about is a total resolution of ankylosing spondylitis, which never happens. Yeah. Those of you who don't know what ankylosing spondylitis, it's when the spine fuses together from top to bottom. And what happens to these patients is that they start to become so immobile, the ribs start to become brittle, they have trouble breathing, the cardiac muscle doesn't have room to move, and basically they suffocate in the later years of their life, really what happens. It's very horrific to watch.
In that case, how many sessions, like how close together, and how many did you do?
He did a total of 70 sessions to resolve his ankylosing spondylitis, and now he comes in about twice a week to maintain his health. Yeah. Yeah.
Did you say that the Blu Room communicates with ourselves?
Yes, it
Can
does.
you tell me how you do that? Well, I'm
Yes.
interested in science because that,
Yeah.
to me,
Yeah.
what science is true whether you believe it or not.
Well, I agree, science is true. That's what I love about science. Basically, your cells, they communicate all the time. You know, that's how you're alive. If your cells didn't talk to each other, we'd all be dead. It's true.
In that Blu Room.
There's a frequency in the Blu Room, and one of them is just light. You can see the light. You know, I explained earlier, when you're out in the sun, your body absorbs light.
Right.
It communicates to you. Your cells pick that up. And there are certain metabolic functions that happen in the body because of that light. So it's talking to you. The Blu Room is about the same, but there's more frequencies in there. There's different frequencies in there. And those frequencies talk health. Be healthy. Turn your frequency back on to health.
And it's the light.
Somewhat of the light, but also the music, and there's some other things in there that's a trade secret I can't quite reveal yet.
I can go with that. Okay.
Yeah. Mhm.
What type of light is it? You think of light, you think of the different types of light.
Right.
bulbs, You think of sunshine, you think
Right.
of UV
This is
light.
mainly UVB. It's ultraviolet blue. Okay? Yes, go ahead.
Would you describe the difference of UVA?
Sure. Sure. UVB is the mildest. I'll start there. It's the safest, and it's a spectrum of light that does the least damage that we know of scientifically to the body. But also there's something beautiful that happens with UVB. UVB is a wonderful communicator, and we're finding whether it's in vegetation life or human life or animal life, it communicates vitamin D increase in the skin, but it also communicates detoxification, it communicates a lot of different things that you're needed. And one is melanin production. You know, we're all scared of melanin. Everyone, you know, you hear melanin, you think of melanoma. Melanin is the beautiful pigmentation that you get when you're out in the sun. You get a tan. Melanin is actually a hormone, not just a color. And what it does is communicate to the body and to the brain chemistry that you're happy, you're healthy. There is no need to further communicating sickness in the body. And we find when you have a good amount of melanin circulating through the body, your immune system will increase exponentially with the amount of melanin that you have. Okay? Good question. Any more questions? Yeah.
How about cartilage?
Cartilage, that's absolutely, does really wonderful to regenerate. I'm living proof of that. Yeah, it does a wonderful, wonderful things for cartilage and decreases pain.
And so if you achieve good results, is it something that then you can say, I'm good to go, or do you, in order to maintain it, do you have to consistently expose yourself to the Blu Room?
Do you consistently have to exercise? You should. Do you consistently have to eat well?
Right?
You should. Do you consistently have to breathe? I hope so. This is whether or not you need to come once a month, once every 2 months, once every 3 months, or you have something that you're trying to heal from. The wellness or treatment regimen will be different for everyone. For me, if I go about once a week, I do really well. I do better if I go 3 to 4 times a week. Sometimes if I'm very stressed, I go every day. It just really is depending on what my body needs.
I guess you have one of these in your house.
I do have one in my house. And I have two clinics globally that have them as well. Yeah. But you know, I'm very blessed. I travel to these, you know, and so when I leave here, I'll be going to Mexico City where there's one being opened up. And then I'll be going back to Ecuador to work in my clinic a little bit, and then I'll be flying to Japan to work with one at the university there. So, yeah. Yes, hi.
I have had melanoma twice.
Right.
Now, is there any, like,
No.
limit to how much, okay.
No, we're going to get into that because this is an important question. Everyone's afraid of light. Everyone's afraid to go out in the sun. Everyone is afraid to, well, everyone is. I mean, we get the crap scared out of us about how deadly melanoma, and it can be. If you have melanoma, it's a very serious condition. But we need to be really wise about what causes melanoma. What causes melanoma? Come on, guys. Give me your theories.
I've never been
Sure.
convinced that it's
Skin damage, and we say that overexposure to sun. But I want us to think really, well, let's think really clearly here for a moment.
Something, and people have individual levels of something that affects how the sun penetrates their skin, sort of.
Maybe.
Yeah, but you can get a melanoma in areas that are not exposed to sun.
Now you're using your brain.
Yeah.
Think about 100 years ago. Where is the documentation of melanoma? Your grandparents didn't have sunscreen. They didn't have sunscreen. What were the cases of melanoma back then? So now we want to talk about something that's really important for everyone to hear, and I always include this in my talk because we don't put this together very well. Women have the highest incidence of melanoma. Did you know that? They do. Now let's think about this. Who wears skin products? Yeah, it's common. I mean, I'm very happy that some of you ladies wear things. I mean, it makes you all look pretty. But let's be very honest about the testing that's gone into these products. Now, the FDA requires that they test their product. 1. Now, let's say that you're using 5. The combination of those 5 products have never been tested together to see what the reaction is. So if you're wearing a foundation, a mascara, a perfume, if your shampoo is different, if the conditioner is different, if you're wearing a certain fabric of clothing that's been chemically dyed or it has formaldehyde, there's all of these chemical combinations that you're exposing your skin to at one time. We don't think about it. We just look at a product on the shelf, we take it off, we put it onto our body, and we expect to be fine. But the science has never backed up what it does when they're in a combination with each other. And then we did something very interesting in the 1950s. We came out with sunscreen, which blocks what? Vitamin D absorption. Vitamin D is one of the most critical nutrients that you can get. And I believe in God. I believe the sky is blue to make us happy. I believe that vitamin D is a gift. You just have to walk outside, roll up your sleeves, and you get a big boost. Now, why is vitamin D so important? Cellularly, vitamin D is the only nutrient that goes into the nucleus of the cell. It repairs your DNA. It tells the cell to repair DNA. And why is that important? That is who you are. That is your genetic material. That is your genetic information. And if your genetic information is being relayed from one cell to the next, or it's being multiplied and it's not healthy, you are not going to multiply and you're not going to heal healthy. You're going to heal sick. Do you understand? Now, how many of us have been told stay out of the sun, wear sunscreen, wear covers? Now let's think about something for a moment. Have we gotten healthier as a people? We've gotten sicker. Worldwide, it is at a crisis. I hate cancer. I've lost lots of good people to cancer over the last 15 years of my career. And what I've seen the most are people who want to be healthy, they just have no idea how to do it. And they take bits of information to make daily choices about their health that don't even make sense, but they're just doing it because they read it in a magazine, or they had one health person tell them that this is a good idea, et cetera, et cetera, et cetera. So please, ladies, listen to me. Do research on your beauty products. Don't buy the cheapest. Don't send me the bill, but don't buy the cheapest. Buy ones that you can actually pronounce the ingredients. Okay? Now we'll go into nutritional supplements. Not all nutritional supplements are equal at all. If you buy your nutritional supplements at Walmart, you're going to get a Walmart value on them. Truly. The same with food. I have a very large plantation in Ecuador. We grow food. Since the last year I've taken over from my father who wanted to retire, I've made many changes. We have kicked Monsanto out of the country. We don't allow them there anymore. Who's heard of Monsanto? Why is that a good thing? Genetically modified organisms have no testing. They have no human trial testing. Yet they are allowed to be put on our shelves, and most people don't even know the difference. Now, who's eaten bananas here? I hope everybody's eaten bananas. Who can tell the difference between an organic banana and non-organic banana? There is a big difference. Now I'm going to give you some education as one who grew up on a plantation. I've been cutting bananas since I was 5. They have seeds. Who knew that? You knew that bananas had seeds? You can see them. Now who has gone to Hawaii before? And you've gone to a farmer's market and you've had a banana. They taste different, don't they? This is what our food has been turned into. It's been turned into a commercial product, not a nutritional product. So when you make a choice to buy, support your local farmers. Buy organic, buy from somebody that you know loves what they're doing, and you're going to get good results. Okay? All right, questions? Yeah.
Can you talk about some of the mental disorders?
Yeah.
This is something out there.
Sure. One that's near and dear to my heart is PTSD. We just did, recently we did a PTSD study on veterans. And who's known someone who has suffered from PTSD? It's a horrible, horrible thing to watch someone that you love go through. So I've personally gone through the VA system for PTSD. It's there, thank God it's there, but it's very limited. And most of the time they make an assessment on you, they'll put you on medication, they do another assessment, and if they give you a green light, thank God, you get out of that system. If they don't, you stay in it. You're in it. You can't own a firearm. There's many different things that happens to veterans this way. So I, for years, have been treating vets. And most of us, we go to alcohol, or we go to drugs, or we go to something to kind of alleviate that stress. Well, I took 30 vets, and I sponsored them. And I put them on a 40-day trial, 30 visits, and all of them had relief of their symptoms. Every single one of them. Now that's one. And I would limit on that one as being a mental disorder, but it is associated with the psyche. Now I'll talk about autism. Autism is something that is prevalent, isn't it? Right? We've kind of taken this diagnosis of autism and we've kind of just thrown all different types of people into the middle of this, whether it's Asperger's or anything else in the spectrum of autism. And it's relatively new when you look at it. Now, we can get into debating where that's from if you'd like to. But what I've noticed with the Blu Room is that it brings that person from where they're stuck in their mind. Now, who has an autistic family member they know of? They're there. They're there. They're in there. The only problem is through the neurology in their head, they can't get that out. They can't express who they are. They can only express in certain limitations of what their neurology is letting them do. The Blu Room has had great success in bringing them back, bringing them back to a functioning being. I'll give you an example. There was a little boy who recently came to my clinic in Ecuador who was diagnosed as having extreme autism, meaning the stimming, couldn't sit still, couldn't go to school, couldn't communicate, couldn't use the bathroom. And this is an eight-year-old boy. And on the parents, this is changing diapers, this is not sleeping at night, this is constantly worrying what they're doing, where they're going, because now they have some mobility. So they brought this little boy to my clinic, and they're saying, we'll try anything, doc. What can we do? So we went on a detoxification program. We went on something called chelation. Who's heard of chelation? Chelation pulls heavy metals out of the body. And he'd been highly vaccinated. I think he had almost 67 vaccinations by the time he got to me. Lots. Lots of vaccinations. So we cleaned out the heavy metals from his system. We put him on a wonderful vegan diet just to let his digestive system kind of have a break. And we started doing intense Blu Room sessions, twice a day, every day, for 1 month, 30 days straight. At the end of that 30 days, he was talking. He was communicating, just like he had never had autism. This is a documented case. So that's what it can do for some mental disorders. Now, who knows what an upper motor neuron lesion is? Docs, I hope you guys do. What does that present as in your practice? I put you on the spot, docs.
Paralysis.
Where? It can, in the legs, it can. Sometimes the extremities, but there is some paralysis, whether it's superficial or whether it's motor, right? Which one is it? You got 50-50 here. It is motor. Very good. So who knows what motor paralysis means? It means that some muscles aren't working. Now here's the interesting thing about upper motor neuron lesions. You can get it from a head trauma. You can get it from a car accident. You can get it from birth trauma. There's many, many different ways you can get an upper motor neuron lesion. I mean, it can actually be toxic as well. There can be toxic effects. But it presents as a muscle just not firing. Now, who's ever seen someone just limping, but they don't know why? No doctor has told them anything's really wrong with them. But they have a limp, they have a gait that's funny, or they have a tremor, or there's something just not quite right. Now, who's hit their head here in this room? It's a hazard of being alive. That's gravity. Now, I want you to think, if you have children, when your children are learning to walk, how many times they fall down between learning to walk, the crawling stages, and the walking stages? How many times? Let's pick one day. The average is 58 times a day. We just go, they're learning to walk, no big deal. Now children, we know they bounce back, don't they? I mean, they're tough. Thank God. But think about it, if a child is growing, they have a good hard fall. Now think of yourselves, they hit their head. Well, maybe you get some symptomology of they have a headache, they have maybe some nausea at some points, maybe they just don't act like themselves. But you understand you're talking to a little being who doesn't have the communication capacities to tell you everything that's going on with them. They can give themselves an injury that turns into what we call an upper motor neuron lesion, which basically it means that certain parts of the spinal cord have been injured. Truly. This can happen in car accidents to all of us. But it's something that is missed. I've had patients who have had paralysis in limbs, who've had spinal injuries for years, that chiropractic has helped, but the Blu Room has totally resolved. So it can really make a difference with the neurology. Now, how we know in the medical field, The neurology is very well protected, isn't it? So your brain and your spinal cord. It's encased in the thickest bone in your body because it's important. It is how your body communicates to the cells. This is how the master system works. But if you have an injury to it, it's very difficult to get to and diagnose. It really, really is. The best of the best probably miss almost 50% of those injuries. Okay? But it makes a big difference. The Blue Room really does make a huge difference with spinal cord injuries. Okay, yeah, please.
If the Blue Room fixes pretty much anything and everything, what do we need the chiropractors for?
Oh. Well, remember I am a chiropractor. No, it's not going to adjust you. It's communicating to your cells. So it goes deeper in a way. So if you still have a crink in your neck, get adjusted. If you still are having problems walking, get adjusted. You know, if you're having other issues, the adjustment is a wonderful tool to bring health. It is. The Blue Room won't take anything away from a modality. It adds to a modality. But it adds to something very, very deep. There's no other modalities out there that can communicate to a cell. You understand? Light can, sunlight can. But how many of you are getting sunlight every day? I mean, let's be honest. If you work in an office, how often are you able to go outside and get yourself an hour and a half to 2 hours worth of sun every day? I mean, this is the reality of the world we live in. It's not. I know for me, being in an office for the last 15 years, comparatively from the way I grew up, I'm not outside at all. When I grew up, I was outside every day, 8 to 10 hours every single day. And then we grew up and things change. But then we have to throw in weather, certain things like this. This is where the Blue Room comes in very handy for vitamin D, but also the frequency of speaking to your cells. Now, who's heard of the power of positive thinking? Who's heard of the placebo effect? What is the difference? Tell me. Who knows what the placebo effect is? I'll explain that real quick for those of you who don't know. The placebo effect is basically if you have a study on something. Let's say we're doing a drug trial. And you are given, one is given a drug, one is given a sugar pill. But what we found, that even in those trials, the ones who think they're getting something good end up having a benefit to it. Now explain that. This is science. This happens in every drug trial there has ever been, period, hands down.
Well, they're expecting to get the one that's working, and
Very
so
good.
they are
So
assessing it like it's working.
so are you communicating to your body that? Yes, because it's you that has the
Yeah.
thought. Do you understand?
You have an expectation that you're getting
Good.
the real one.
Good. That is that is you up here communicating to your body to have an effect. Now, who's had a dream that they've fallen before? What happens to you?
Wake up.
Heart's pounding, you're breathing. Were you really falling? But your mind thought you were. So you had a physiological ramification from that. So this is powerful. Now, what the Blue Room does is communicate healing to your body. Now, if you go in thinking you're going to be healed, you add to that. Just like if you go in to see the docs and you go, I know I'm going to get better today. You are going to get better today. But really, that is you. That is your cells. That frequency is your cells. I spoke about love at the beginning. What is that feeling like? It's awesome. Who has children? They make you smile, don't they?
Sometimes.
All right, good point.
You haven't met mine.
But that love always does, right? That feeling. That's health. That really is where health comes from. That frequency. Now, I want us to stop for a minute. How often are you in that frequency?
Not very.
Why?
Work.
This is important. Everyone understands this. If you aren't in that frequency of health and love and healing, then where are you? How do you expect to be healthy? This is what I came to as a doc. Seen all kinds of people come to me for all different types of things, trying to figure out where the common denominator was between health and sickness, we're right at it right now, what we're talking about. Those who have been the sickest that have come to me in stage 4 cancers or something else, and they are willing to get better. They love themselves, they love their life, they love their family, or they find something to create that frequency, they get better. But this Blu Room helps. And it's that same frequency that you would have in your mind of health and love, all of those things. That's what that is. So that's what it's communicating to you. And that's why it has such great success at healing everything. Because when that frequency really is in the body, you are going to be healthy.
What about patients with dementia?
It's amazing for that. Yeah, it is. Yeah, that was a big one, a study that I did with a nursing home. Yeah, very, very important. Yeah.
I've also heard of memory patterns that your muscles hold from like childhood or any traumas of the past.
Right. Are you asking me a question?
Yes.
Okay.
How does it address that?
Oh, you know, that is a good question. Those trauma patterns, they are real. You know, I mean, we could document them scientifically. The Blu Room has such a wonderful way of giving the frequency off that those things kind of alleviate. But it really comes down to you letting go of your past, you being willing to forgive and kind of move on. It's the same, that's what PTSD really is when you look at those. They're very similar in a way because they are trauma patterns. They are trauma patterns of holding. And it is emotional, but here's the thing. Are you an emotional being? Are we emotional beings? Yeah. Are we physical beings? Yeah. Are we spiritual beings? Yeah. So if you don't treat all of those, you're missing something. You understand? Okay. Yeah.
Do you have some sort of way that you determine how often and how aggressive someone's Blu Room treatment would be? Like as
Yeah.
far as something acute, something chronic, something
Yeah.
passive, something, you know.
Right.
How do you determine that?
Well, it's necessity. So if I have a patient that is terminal or they're close to being terminal, I'm very aggressive. I pull out all the stops. And in fact, we were discussing this today. I require them, if they're going to be my patient and they are terminal, then I require that they're on my terms, not on their terms. Their terms haven't worked. And so I require that they come to Equilor or they come to one of my clinics. They're out of their whole life. They're out of the norm that has gotten them sick. They don't go to work. They don't eat the same foods. They aren't around the same people. And we do aggressively up to 3 times a day in the Blu Room, as well as changing their diet, adding some herbs and some other things into their life. Yeah.
And you've seen good results from that.
I'm almost at 100% at my clinic in Equilor of healing people. Yeah. Yeah. Any more questions? Yes.
Does the healthcare in Ecuador pay for the Blue Room?
No, not yet. We're working on that right now. The universal health care in Ecuador is very good, but I only charge for a Blu Room in Ecuador, which would be equivalent to here about $45 per session. So when you're thinking about normal care, it's very inexpensive comparatively.
You talked about being in Asia, South America.
They're all over the
US.
world.
Is there in Europe?
They're in Europe, and in one part in Germany, they have health care that covers the cost of the Blu Room. And so it'll start coming more and more and more. Yeah. Yeah.
You
Yes?
mentioned the intention that you have when you use a Blue Room.
Mhm.
So you come in with a really poor intention. You know, you've given up, you don't think anything can
Right.
help you. Is the Blue Room able to override that a little bit?
It can, a
Like
little
therapy?
bit. But remember, you're the master programmer. So anything in your life, if you approach it with a bad attitude, you're going to most likely have a very bad outcome. I mean, you teach your children that, don't you? Yeah, it really is true. Yeah. Any more questions?
Any experience with autoimmune conditions like type 1 diabetes?
Oh, absolutely. Yeah, I've had a full resolution of type 1 diabetes. In fact, I have had pancreatic cancers resolve quite well. Lupus, psoriasis, ankylosing spondylitis is autoimmune. RA as well. Yeah. Yeah.
And what was the protocol then for, it must have been intensive?
I've had some that I've used very intensive depending on the stage that they were at. And I've had some that were very mild cases. They were just in the beginning. And so we weren't as aggressive, but they still got very good results. Yeah.
In the case of the type 1 diabetes,
Mhm.
how often would you say?
It would depend on where they're at physically. You know, if the type 1 diabetes has gotten them to a place where they have neuropathies or they're looking at surgery to amputate, then I'm extremely aggressive. 3 times a day, change the diet, change the environment, et cetera. Yeah.
And then
Yeah.
for the child, the 7-year-old?
Do they have type 1?
Yep.
Then I probably would say 1 time a day. And children are so wonderfully able to heal because they don't have the blocks we have, that probably you'd find in about 10 to 15 sessions a very good outcome. Yeah.
This person lives like an hour away, so it might be a little tricky to get them here
It's worth a shot.
once a day. I think.
That's worth a shot. Mhm. Yeah, any more questions? Yes?
Just a real basic one.
Sure, yeah.
So it's a light therapy. Why is it that you do not have to expose skin? I mean, there's a blanket.
That's a good question.
that you stay closed,
That's a good question.
and,
I do recommend that you expose as much skin as possible. It's not necessary. Your skin is a wonderful receiving organ for light. So when I go in it and I have my own treatments, I usually have about half of my clothes off. But that's really up to you and your comfort level. Now, if you are a terminal patient, you will be mostly clothless. You will. You will want to absorb as much as you can, and that's what I recommend. But if you're going in for general health and wellness, you can leave most of your clothes on. You know, just go in there, roll your sleeves up, and get a good shot.
and then
Yeah.
part 2, again, basic. If, say the first session, the lights are on for a certain amount of time, yet you remain in the room.
Right.
What's happening during the time that the
Right.
lights are off? What continues to happen to you?
Well, there's still a frequency in the room.
Okay.
You know, and it continues. Who went and looked at the room and felt a little different when they went in there? That's the frequency you're feeling. And it's partly the lights, but it's partly the geometry. It's also the music. It all mixes together. There is this wonderful frequency that's there. Good question, so. Yeah.
Being a medical doctor, what has been your, in the medical world, what's been the reaction and your take on this?
Personally, I don't care.
And I mean, as far as, there's always that other side.
Right. There is. And I've had debates, but usually what I say is just look at the research, look at the patient results, and I really could care less what another practitioner thinks if my patients are getting healthy.
Do you feel that, that's a struggle, I guess, in the U.S. to get, to grow this therapy and increase this therapy? How do you see working around that?
I truly believe that all of us healthcare practitioners have gotten into the field because we want to help. I don't think anyone goes through a tremendous amount of school because they just want to do it for a job. There's a need to help. I think it's mostly education that's a difficult thing, and going through medical school, going through chiropractic school, going through some other training that I have, you're indoctrinated. I mean, it really is the truth. Any program you go through, you're going to get one side of the story. And whoever's writing the book, you're going to get their side of the story. The thing that I love about what's happening now in the world is that we have access to the World Wide Web. So people are more educated now than they ever have been. That could be a good thing, could be a bad thing, depending on what you're looking at on there. But you can start to research things yourself. And who has been to a doctor and they've said something to him? I've said things that I went back later and went, oh, I was totally wrong about this. We're human. We're human. And we do make mistakes. And there are intentions that are good, but sometimes you give advice that maybe didn't quite work out with one patient, but it worked out with another patient. So what I find mainly is that I have 50-50. I have some practitioners or docs out there that are like, this is amazing. I want this. This is the best thing I've ever seen in my life. And then you have the other side that go, baloney. I want to stick to the way I've always practiced medicine. And that's up to them. That's up to them. Yeah.
Have you written anything?
Yes, I have.
Because I'd be very interested in reading it.
Okay.
Can I find out? Okay, thanks, Sarah.
So,
Mhm.
okay, I just had blank.
That's okay.
Peter Washington, no, sorry. So, if someone comes here to the Blue Room,
Mhm.
who determines how many sessions, depending on their illness? Because
That's going to be worked
no
out
offense,
between them.
but, I mean,
That'll be worked out between
doctor, I mean,
between
yeah,
it. But here's the beautiful thing. Both of them can make educated decisions to help you. But this is what I want to empower all of you with. Guess whose choice it comes down to? Yours. And if you don't believe in what you're doing, it's not going to help you much, because then you have doubts. Do you understand? You need to be in charge of your health. The biggest advice I give to all of my patients is this: if you aren't in charge of you, who is? Who is? And why are they making decisions for you? And what are they making those decisions based off of? Do you understand? Now, who's been in their body the longest? You. It is your responsibility to get to know your body. Okay? Now, one of the hardest things is we aren't born with a manual. There isn't like, okay, welcome to this world, here's the manual, read up to page 75 by the time you're 8. There isn't that. There is life experience, right? Make your life experience to be about you. Understand you. Understand what foods you function best on. Understand what amount of sleep you need a night. Understand, I can handle this amount of stress level versus this amount of stress level. I understand that I need to have this much fun in my weekly regimen. I need to have this much exercise in my weekly regimen. Do you understand? There isn't enough of this education out there yet where people are able to make informed decisions on their health based on your experience, because nobody's out there experiencing it. Now, who knows how much exercise they need in a week to feel good? Who's experimented that far? Anyone? How much?
I exercise 4 days
And it works great.
a week. Works great.
Some people it's 3 days, some people it's 2 days, but that's why you're an individual. Do you understand? It's your responsibility to find that out. Now, coming up with a treatment plan, that's where you want to get advice. Come to these two people. They're in constant communication with me, will help. Okay? Okay.
Would this help a MS patient?
Absolutely. I've had full resolution of MS through the Blu Room. Yeah. Yeah. It's important to get it in the beginning stages, though. Very important.
She's had it 30 years.
It will help. It will definitely help. Yes?
What about scar tissue?
Scar tissue is something that's very interesting. Why does your body heal in a certain way? What is scar tissue? Who knows?
It's how your body repairing areas that have been customs or damaged.
So is that communication system very good?
Not so good because
Right?
it starts.
Is that how normal tissue would lay down?
Say that again?
Is that how normal tissue would lay down? No. Why does it lay down that way? This is where I like everyone to start using your common sense and your minds.
Trying to protect something, I would say.
A little bit. Yeah. Yeah. Now, how does scar tissue heal? There are two ways we know scientifically that scar tissue heal: exercise and manual therapies. Massage, certain things like this, PT, you break up the scar tissue, and then what happens? Proper alignment, proper nervous system function, proper cellular function. So yes, the Blu Room does help with scar tissue tremendously. It allows that cellular communication to go back to normal, so it rights itself. I've had people, who knows what a lipoma is? Lipoma are fatty tumors that happen. Sometimes they get below the muscle and they're very, 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 very painful. I've had lots of resolution of lipomas. I have lots of resolution of massive burn, scarring, which is massive scar tissue all over the body. And the best thing is the Blu Room helps decrease that pain, helps decrease that down to where they can manage it. Because that's one thing about scar tissue, it immobilizes a joint, it immobilizes an area, and then you're dealing with an immobilization that causes massive, massive pain. And who's had pain here on a daily basis? Wouldn't you like to decrease that pain? Yeah, it's terrible to live with. It's difficult to sleep with. Yeah.
How about leukemia?
Leukemia is, I've had really good results with leukemia. Leukemia is there's different types. And sometimes, depending on where they are, it can be a difficult one to treat with any type of treatments.
CLL.
I've had full resolution of CLL.
Really?
Yeah, yeah, yeah. Mm-hmm.
Arthritis and, what do you call it, deficiency, iron deficiency?
Well, you have to take iron.
Well, yes, I understand that, but I have a loved one that is iron deficient.
Right.
And curious about that, I know she's always constantly cooking on iron, skillets and stuff.
Good.
Trying to get more iron.
Do you know about intrinsic factors?
I do not know.
Okay, does she? Do you know if she does? Intrinsic factors are really important. They're factors, they're vitamin B that help you absorb iron into the digestive system. And a lot of us, you get a blood test, you're iron deficient, here's an iron supplement, but if you can't absorb it, it won't help you. And so clearing up those issues are really important. And arthritis can be a direct result of having some iron deficiency. Now, why is iron important? Hemoglobin. Who's heard of hemoglobin? If you don't have enough iron in your system, the red blood cell cannot bind to a shuttle to go into the lungs to grab an oxygen molecule. So you slowly suffocate to death on the inside. And what happens then is you have massive inflammation that comes from that, which can then in turn into arthritis. You understand? Okay. So I truly believe that the digestive system has to be healed. Now, vitamin D is such a critical component of having a properly functioning digestive system. Okay?
What should your level be?
I like it 60 to 70. That's optimal. That's optimal. Vitamin D level on the blood. I want you to get with these two afterwards. Talk about getting your labs done. It's really important. And getting a vitamin D level study is inexpensive. What was it? $25. I mean, it's worth it. It really is worth it. And if you get those levels up, I guarantee you will see some major health benefits. Okay? Any more questions?
High blood pressure, cholesterol?
Yeah, that is a good question. What's really cool is I do, before I did any of my studies, we did basic diagnostic tools to use before we did any research, and that one was blood pressure. The Blu Room is wonderful at decreasing blood pressure. So if you have chronic high blood pressure, the Blu Room, if nothing else, will help you decrease that. It really does. More questions? Yeah? Yeah.
So if this helps with the blood pressure and all this stuff, would you be able to go off the medicine?
You'd have to get with your doc. You're not my patient, so I can't really give you that advice. But what I have seen from my experience is that, yes, I've had lots of patients either decrease their meds or completely get off of their medication because everything is right. The body's functioning properly.
But then you have to maintain it.
Well, you better maintain it.
I mean.
You're going to maintain it one way or the other. Pick one.
I think what I mean is to go to the Blu Room, you get it all straightened out and everything.
Mhm.
And then you should go like maybe once every month.
Yeah, you can start to determine that, and you'll know very quickly. I mean, are you talking about yourself personally? Yeah. Yes, you are. It's okay. Here's the truth. I'm a doc. I can tell you in the beginning of my career, I handed out millions of drugs. I'm not even joking. That's how we treat. Now, is it a bad thing all the time? No. It is a necessity. But we have, especially in this country, we have an emergency medical model that we have tried to fit into a wellness model. And they don't fit. Do you understand? So what we do is we have an exacerbation. Your high blood pressure is not a norm. It's not a norm. You should have normal blood pressure. But what we do is use medication to help normalize you. But really, in the future, what we want you to be is able to do this on your own. But if you aren't taking steps to do that, then yes, you should be on some medication to help maintain that. But hopefully not, because you're going to get healthy. You understand? Okay.
It sounds like it's harmonizing your body.
That's exactly what it is. That's a good way to put it. Yeah. That's exactly what it does.
So how long are you in the treatment? What's actually going on when you walk in the door to do the treatment?
Yeah, it's when you walk in to do the treatment, you're being saturated with a frequency. It's like music, like harmony. And that frequency, it's like communication. It's talking to your body. It's talking to your body. It's talking to your cells to be normal, to function normally.
You go in and you lay down,
Mhm.
and then do you cover your eyes? Like,
You
what's
can.
actually happening
You can.
as far as you showed that jug of water?
Mhm.
So how is that playing? Is it just there to reflect?
No, you can actually drink the water. So you're drinking the frequency of the Blu Room.
As you're doing,
If you want to, or afterwards, it's up to you. I've even gotten to the point in my plantation, I own a very large plantation in Ecuador. My family does. And we irrigate with Blu Room water. And we've had great results. Great results. Because water holds frequency, holds memory. So who smelt city water? Oh, and who smelt wonderful well water? Now, which one would you want to drink? Right, right. Yeah.
When you're in the Blue Room and say you have scar tissue in your stomach, does that area have to be out where it can reach?
It would be a good idea to expose it. What kind of scar tissue? Surgery?
Many surgeries.
Okay. Are you getting any soft tissue work with it as well?
Very little.
Okay. I think there's a wonderful person here that can help you with that as well. I would recommend that you do get the body work with it, but use the Blue Room in conjunction and you'll see the results just really skyrocket. Okay? Okay? Yeah. Any more questions? Sure? Yeah?
Talking about the, autism and all that.
Mhm.
I know someone that's got ADHD,
Mhm.
you know, I don't think it's really bad, you know,
Mhm.
but would this help? I mean, 12 years old,
Mhm. It would help.
you could just, if you can get their mind,
Yeah,
if they would do it.
it would help. I'm going to give you some, every child is ADHD, okay? I'm going to tell you right now, every adult is. You know, we were really never meant to be put into a box and told, sit here and focus for 7 to 8 hours without having any other thoughts. Good luck. Good luck. We were meant to be outside and moving. Children learn by moving. That's what they want to do. Playing isn't really just about playing. As adults, we're kind of programmed to look at children, oh, they're just playing. That's how they learn. If they aren't being physically active, they aren't learning coordination, they aren't learning how their body moves, they aren't learning how their heart rate goes up, what sweating is. I mean, there's so many different things, hand and eye coordination. There's so many things that they're learning during this process, but we take it away from them a lot of times. Now, when I was going to school, we had recess 6 times a day. We were outside more than we were inside. And now my children are school age, they have 2 recesses. I'm thinking, how in the hell can they sit there that long? They're my kids, I know them. But it's true. If you aren't moving, even as adults, you are losing education and feedback to your body. Okay?
Because it makes you feel good.
It does make you feel good. It does. It is very important. But the Blue Room can help calm them down. You can be overstimulated as a child. And you think about all the electronic devices that children are. I mean, when we were kids, I mean, God, video games just came out when I was a child. And I never got any of those things. But now you see children who are young, who are on their iPhones, they're being stimulated by that electromagnetic field, also TV. I mean, it's everywhere now. And it really does some damage to them. And so it's important that they're more physically active. I usually say this to my children. If you have 1 hour of TV or video games, you need to be outside 2 hours. And that's the deal that we make. Okay? All right. Any more questions? I think so too. Little harder to get adults to do that stuff.
You just need to create a Blue Room app that has the blue light.
Right. Right. Yeah. Your mind thinks that way. Good. Very good. Any more questions? Thank you, everyone. I'm always available to answer questions. Get with these 2. They can email me if you think of something. But please, you have a free session. Utilize it. Get in there. All right? I guarantee you'll enjoy it. Thank you very much. Thank you.